Johan, a large part of your work involves lobbying around healthcare for the LGBTI community. Tell us about some of your work. Tell us about the healthcare situation currently when it comes to the community.
Yes, a lot of our work in the past revolved around lobbying for healthcare because in 2003, it was part of a larger study that was done. We call it the levels of empowerment, where we specifically did research on people's experience of access to healthcare services. And this is specifically LGBTI people. The other point that the study also looked at was also people's experience of victimization. So it was basically the two issues. And there we learned that people don't access healthcare clinics and the health system because of fear that they might be victimized or discriminated against. That fear might be real, it might be just perceived, but that was still the fear that existed in people's hearts. So people would rather leave their health as a last priority than go to a public health clinic and be be made vulnerable in that way. So what happened is we started our own clinic here at LGBT Wellbeing in 2006. We offered HIV counseling and testing, sexually transmitted infections, screenings, and also treatment. We started with a full-time registered nurse, and we also had a medical doctor who came in once or twice a week. We had funding for that so that we could afford these to pay for these services so that we could offer it for free to our clients. We were also able to offer ARV treatment for free. Unfortunately, that funding came to an end. However, we still continued with the clinic. However, our services was a little bit limited then. We could still offer the free HIV counseling and testing, the STI screening and treatment, but we could not offer the ARV treatment for free. But now we are very happy to report that our clinic is now integrated into the Tshwane health system, public health system, as the designated key populations clinic. So what that means is that we are part of the public health system now. We get medication from the public health, from the Department of Health, and we can offer ARV treatment for free. We could offer a second full-time nurse as well at our clinic, and therefore we could increase the numbers, we could increase the services that we offer. So that's where we currently stand, and we are very happy about that. So what we experience is, although there are many problems, we experience that the Department of Health is really trying from their side to also be part and parcel of this. And this is actually a very first of its kind, where a clinic from an NGO partners with government. And it's really a pioneering thing that is happening.
Johan, we recently interviewed an intersex woman who really had a struggle when it came to getting healthcare. She described in great detail to us how she was refused healthcare treatment at her local hospital because they insisted that she have her gender changed on her identity documents. And despite the fact that she was struggling with home affairs with this, she was at the same time being denied vital treatment. Unfortunately, this is a story we hear all too often when it comes to members of the LGBTI community. Now, where can South Africans who are struggling with these issues go for help? And what is your advice or encouragement to people who are dealing with these types of bureaucratic hurdles?
Yes, that is unfortunately also true. And I would almost say, although that might not be the correct term really for this, but I would almost say that this is the next battle. The battle was first for the LGB people to be recognized, and unfortunately in the process the transgender and the intersex people were left behind. So it is really time, and it's the right time now, I also feel, where we can include the rights of transgender and intersex people, and where we must lobby for change there as well. It is a reality that there's only 2 hospitals in South Africa that offer treatment. When I say treatment, I'm talking about hormone treatment and so on. Of course, private institutions do that, but that is at a cost, and not all people are able to access the services there. So, in terms of public health, there's only two hospitals: the one in Pretoria and one in Cape Town. And if people are considering to go for a sex change operation, then there's a very long waiting list, the way I understand it, and people can wait for many years. So what we see is many people revert to going overseas to get that done. And of course, once again, it's only if they have the resources. So I think it's time that we start taking up the battle for the rights of transgender people and intersex people, and ART is currently looking at ways of doing that. We are looking at including a support group for transgender people. We also decided to include a transgender group as part of our programming and our next project for the next year. So I would like to say to transgender people, there is a little bit hope. I don't want to give false hope and too much, of course, because we must be realistic in terms of the time that these things take. But I do think that there is hope, and one should not lose hope.